HIV is a virus that attacks the immune system. This system protects your body from illnesses. AIDS is the most serious stage of HIV infection. When HIV weakens the immune system, it becomes vulnerable. The body can't fight off infections as effectively. This makes people with HIV more susceptible to opportunistic infections. These infections are usually harmless in people with healthy immune systems. Early detection and treatment of HIV are crucial for preventing progression to AIDS. Night sweats are a common symptom of HIV. They are episodes of excessive sweating during sleep, so much that your bedding and clothes become drenched. These sweats are distinct from those caused by a hot room or heavy blankets. Night sweats related to HIV can occur even when you're cool. They happen due to the body's inflammatory response to the virus. The immune system releases chemicals that can trigger sweating. While night sweats can be caused by other factors, it's essential to get tested for HIV if you're experiencing them, especially if you have other risk factors for HIV. HIV infection progresses in stages. Understanding these stages is crucial for managing the disease effectively and improving the quality of life for those affected. Each stage presents unique challenges and requires different approaches to treatment and care. Each stage has its own set of symptoms. Recognizing these symptoms early can lead to timely intervention and better health outcomes. Let's delve into the specifics of each stage to understand how the disease evolves over time. Stage 1. Acute HIV infection. This is the initial stage of HIV infection, and it typically occurs within 2 to 4 weeks after the virus has entered the body. During this period, the virus multiplies rapidly, and the body's immune system responds by producing antibodies. This stage occurs within 2 to 4 weeks of contracting the virus. It's often referred to as the acute retroviral syndrome, or primary HIV infection. The symptoms can be quite similar to those of other viral illnesses, making it easy to overlook or misdiagnose. You may experience flu-like symptoms. These symptoms can range from mild to severe and may include fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. These include fever, headache, sore throat, and swollen lymph nodes. It's important to note that not everyone will experience these symptoms, and some people may not feel sick at all during this stage. However, the virus is highly transmissible during this period. Stage 2, clinical latency, or chronic HIV infection. This stage is also known as asymptomatic HIV infection or clinical latency. During this phase, the virus is still active but reproduces at very low levels. People may not have any symptoms or only mild ones. This stage can last for several years. In fact, with proper medical care, including antiretroviral therapy, ART, people can live in this stage for decades. It's a period where the virus is quietly active, but the immune system is still able to manage it to some extent. HIV is still active but replicates at very low levels. Regular monitoring and adherence to treatment are crucial during this stage to prevent the progression of the disease and to maintain a good quality of life. You may have no or few symptoms during this stage. It's a time when many people feel relatively healthy and can continue with their daily activities without significant interruptions. However, it's essential to continue regular checkups and follow medical advice. Stage 3. AIDS. This is the most advanced stage of HIV infection. AIDS, or acquired immunodeficiency syndrome, is characterized by a severely weakened immune system, which makes the body vulnerable to a wide range of infections and diseases that it would normally be able to fight off. The immune system is severely damaged. This damage is primarily due to the destruction of CD4 cells, which are crucial for immune function. When the number of these cells falls below a critical level, the body becomes susceptible to opportunistic infections. Opportunistic infections and cancers become more likely. These can include infections like tuberculosis, certain types of pneumonia, and cancers such as Kaposi's sarcoma and lymphomas. Early detection and treatment are vital to managing these conditions and improving the quality of life for those living with AIDS. Early symptoms of HIV can be easily mistaken for other illnesses. This is why it's so important to get tested if you have any concerns. Common symptoms in the early stages include fever, chills, rash, night sweats, muscle aches, sore throat, swollen lymph nodes, and mouth ulcers. It's important to note that not everyone will experience all of these symptoms. Some people may experience no symptoms at all. Section 5. Early diagnosis is key. Early diagnosis of HIV is crucial. It allows you to start treatment early and live a longer, healthier life. When HIV is detected early, it can be managed more effectively, reducing the risk of complications and improving overall health outcomes. Early diagnosis also helps in preventing the spread of the virus to others, as individuals who are aware of their status can take necessary precautions. There are several tests available to diagnose HIV. These tests are designed to detect the presence of the virus or the body's response to it. The choice of test may depend on various factors, including the time since potential exposure and the availability of testing resources. The most common is the antibody test, which detects antibodies to HIV in your blood. Antibodies are proteins that your body produces in response to an infection. This test is usually performed using a blood sample, but it can also be done using oral fluid or urine. Other tests include antigen antibody tests, which can detect HIV sooner than antibody tests alone. These tests look for both HIV antibodies and antigens, which are parts of the virus itself. Antigen antibody tests can identify HIV infection in its early stages, often within a few weeks of exposure. Another type of test is the nucleic acid test, or NAT, which looks for the virus itself in your blood. NATs are highly sensitive and can detect HIV infection very early, sometimes within days of exposure. However, they are more expensive and not as widely available as other tests. If you're diagnosed with HIV, your doctor will work with you to develop a treatment plan. This plan will be tailored to your specific needs and may include a combination of medications and lifestyle changes. Regular monitoring and follow-up appointments are essential to ensure that the treatment is effective and to make any necessary adjustments. Treatment typically involves antiretroviral therapy, or ART. ART helps to control the virus, reduce the risk of transmission, and improve the quality of life for people living with HIV. By adhering to the prescribed treatment regimen, individuals can achieve and maintain an undetectable viral load, which means the virus is not detectable in their blood, and the risk of transmission is significantly reduced. Section 6. HIV treatment, antiretroviral therapy, or ART. Antiretroviral therapy is a life-saving treatment for HIV. ART involves taking a combination of medications daily. These medications work by stopping the virus from replicating in your body. This helps protect your immune system from further damage. ART is highly effective in suppressing the virus. When taken as prescribed, ART can reduce the amount of HIV in your blood to undetectable levels. This means that the virus is effectively controlled and cannot be transmitted to others. Section 7. Managing night sweats practical tips. While ART, or antiretroviral therapy, can help reduce night sweats, some people may still experience them. Night sweats can be particularly bothersome, affecting the quality of sleep and overall well-being. It's important to address this issue not only for comfort, but also for maintaining a healthy lifestyle. Here are some tips for managing night sweats. Sleep in a cool room. Keep your bedroom cool and well ventilated. This can be achieved by using fans, air conditioning, or simply opening a window to allow fresh air to circulate. Adjusting the thermostat to a lower temperature before bedtime can also make a significant difference. Use breathable bedding. Choose lightweight, breathable bedding made from natural fibers like cotton. These materials help wick away moisture and allow for better air circulation, keeping you cooler throughout the night. Regularly changing your bedding and opting for materials that are known for their breathability can greatly enhance your comfort. Wear light clothing. Opt for loose-fitting, light-colored pajamas. Light-colored fabrics tend to reflect heat rather than absorb it, and loose-fitting clothes allow your skin to breathe more easily. This combination can help reduce the likelihood of night sweats and improve your overall sleep quality. Avoid caffeine and alcohol before bed. These substances can interfere with sleep and worsen night sweats. Caffeine is a stimulant that can increase your heart rate and body temperature, while alcohol can disrupt your sleep cycle and lead to dehydration, both of which can exacerbate night sweats. Stay hydrated, drink plenty of water throughout the day. Staying well hydrated helps regulate your body temperature and can reduce the severity of night sweats. Keep a glass of water by your bedside to sip on if you wake up feeling hot or thirsty during the night. If night sweats are severe or interfering with your sleep, talk to your doctor. It's important to communicate any persistent symptoms to your healthcare provider, as they can help determine if there are underlying issues that need to be addressed. They may be able to prescribe medication to help manage them. There are various treatments available that can help reduce the frequency and intensity of night sweats, allowing you to get a better night's sleep and improve your overall quality of life. Section 8. The importance of ongoing care. HIV is a manageable chronic condition. Regular medical care is essential for people living with HIV. Your doctor will monitor your viral load and CD4 cell count. These are important indicators of your immune system's health. Regular checkups allow for early detection and treatment of any opportunistic infections. It also ensures that your ART regimen is working effectively. It's also important to adopt a healthy lifestyle. This includes eating a balanced diet, exercising regularly, and getting enough sleep. Section 9. Living a healthy life with HIV. With early diagnosis and consistent treatment, people with HIV can live long and healthy lives. ART has significantly improved the prognosis for people with HIV. It's natural to have concerns and questions after receiving an HIV diagnosis. Your healthcare team is there to provide support and guidance. Remember, you are not alone. There are many resources available to help you navigate living with HIV.